Hi class. For this week's discussion, my topic is applying some contemporary resistance training evidence for pregnant clients, looking at how these resistance training methods benefit women and kind of how the thought process has changed over time when working with these clients, diving into a couple different areas of benefit, including physiological response, respiratory response, and hormonal changes, and how these all kind of tie together to support the benefits for pregnant women. So a generalized overview here to look at the old way of thinking, whereas resistance training was dangerous and offered um, additional stress to the mother and therefore the fetus. That notion has sort of worked its way out. I mean, I'm sure there's still plenty of misconceptions along the way, kind of like the topics we've talked about the last 2 weeks. Um, Newer findings support many different benefits. A couple that you can see here on my graphic. An overall easier pregnancy, just kind of the improved level of fitness of the mother leads to an easier pregnancy. Improved cardiovascular health, a healthy weight gain or control of the weight that is gained during pregnancy, avoiding common health issues with pregnancy that I'll talk about a little bit further, and then improving stamina, which therefore improves overall health and your ability to go throughout your day. Um, Moving right along to physiological response, a couple of different things to note here. Um, Improved glucose control, which is a big factor when we're talking about the weight gain benefit or weight gain conversation associated with pregnancy. This helps to improve the likelihood of not seeing preeclampsia or high blood pressure during pregnancy, and also gestational diabetes, two of the bigger concerns that you would see with unregulated weight gain during pregnancy for the mother. Some improved blood flow to the fetus, which reduces the stress that the fetus places on the mother's body directly. Improved sleep, which we all could benefit from, I'm sure, but especially pregnant women due to the additional stress of carrying the fetus. Reducing fatigue throughout the day, better mood and energy levels, again, things that we could all benefit from, but certainly very important for pregnant women. So moving on to some respiratory responses, we have development of the muscles of the respiratory system. So what that means is you look at the diaphragm and a couple of the other muscles that are involved with breathing. As those are developed and less fatigued, you have an improvement of cardiac efficiency, which improves the tolerance of exercise and physical exertion over time, leading to a better onset of the benefits of aerobic exercise itself as well. So they kind of work hand in hand to see an overall benefit of improved oxygen uptake and distribution and improved resting heart rate for the mother. Um, the next kind of side of the argument or area of conversation would be hormonal changes. So there is a plethora of hormonal changes going on during pregnancy, certainly both in the mother and fetus that are kind of out of the scope of this conversation. But what I focus on are things that are positively benefited from a hormonal standpoint via resistance training, that can include kind of the old mentality of thinking that insulin growth factor 1 or other hormones related to fetal growth and mother weight gain were benefited. And diving a little bit deeper in some more modern research, I found a direct impact with leptin level increase that led to supporting healthy weight gain for both the mom and the fetus, and an improved insulin response along the way with that versus an unregulated like blood glucose level and increases or substantial rate of growth within the fetus and the mother, leading to other health concerns that I talked about previously in my physiological section. So that is, again, a simplification of the hormone areas related to pregnancy, but directly related to resistance training is that beneficial level increase of leptin and glucose regulation within the body. So just to summarize a couple of my thoughts, some takeaway notes, if you will. Cardiorespiratory health increases. You see many benefits through being stronger, leading towards what can be defined as an easier pregnancy. Um, a healthy weight gain associated with that as well. So it boils down to being able to not only go through your daily life, but also not as fatigued by doing those things that you have to do anyways. Um, Avoidance of some of the common not diseases, sorry, but some of the common symptoms or things that would happen during pregnancy, including preeclampsia and gestational diabetes. And then the toleration of the fetus for the mother, being that there is new body mass and or draining uh, things happening to the mother's body. This increased strength and fitness level helps to overcome those things. So thank you for your time, and I look forward to hearing from the rest of your presentations and your feedback.